Talk. Let's begin, Dr. Oji. Talk to us. How did you receive that news when you heard?
First of all, I want to start by at least saying that it is good that finally the top government officials, be it in the executive or in the legislature, have come to realize or have come to agree with us this phenomenon of brain drain in the medical sector that we've been shouting about all this while. We have been on this matter for so long, and we have tried as much as possible to engage the government to make them understand the implication. And we have profiled solutions severally on how to address it. The only problem now is that the solution that the honorable member is trying to introduce is going to worsen the problem. It won't solve it. And you see, if you go through that bill closely, you even realize that the bill is an affront to the Constitution of Nigeria and to other enabling laws that guarantees freedom of movement, dignity of labor, laws against enslavement, and all that. And you see, probably because he's not in the medical sector and he didn't bother to carry anybody along, he quoted figures there that are completely untrue. You cannot say that we have 10,000 doctors in Nigeria. That can easily be identified not to be true. But we at least commend him for trying to bring up a solution. However, the solution that he's trying to bring about is completely outlandish and cannot effect the changes he's trying to effect. Thank you.
Dr. Oji, you know why people are talking about this? Because this bill, despite all the flaws that you've mentioned now, has passed through second reading. Shouldn't that be a concern to you?
It is really, even though we also know that sometimes bill can be easily passed like that in quick succession in the House of Rep. But again, these are the things that we also want to draw attention of our honorable members to. We know they mean well for Nigeria, but before you engage on things that will directly affect a group of people, it makes sense for you to involve them. At least hear them out, hear their leaders out. Because you will gain a lot from doing that. I'm sure they are already seeing the nationwide outcry. In fact, it has gone global, because I'm sure you are aware that even the World Medical Association has come into the matter already. They have also condemned it. So seeing all this outrage, it will be a big lesson to them. You can't just try to make laws for people without carrying those people along. I know they will say, yes, public hearing is there. But before you even get to that, at the inception, when you are trying to conceptualize the bill, you need to carry people along so that you don't get to the stage of public hearing and it will be thrown out. All your effort will be wasted. And that's why you see them, even when they get to that stage of public hearing, when they even see that, look, this thing is totally being condemned, they will just look at the effort they have put into it and begin to insist that they pass such laws. And you end up having laws that are not implementable or that are even not that are anti-people, So that's the problem.
I want you to drill down on this particular bill, because I mean, look, the House of Reps is the House of Reps. They will only, I mean, you and I, we can say that the lawmaker didn't do, a thorough job with the numbers that he quoted in that. But he has members, colleagues at the House of Reps who also did not even bother to do anything about the numbers that the gentleman, quoted, and they didn't see any problem with the. To them, they are seeing it as a good idea to be able to, keep doctors in country and have them serve, the fatherland before they can leave the country. That's their focus. That's what they are looking at as to how to keep doctors in country. Now, talk to me, Dr. Oji. What should be the first thing to encourage doctors to stay in Nigeria? Because I know that this is not just about doctors alone. We have other healthcare, practitioners in this basket as well. Almost everybody is living on it daily. You can give us I know you have the numbers. You can please, throw in the numbers if you've got them, for us. But let's start with the basics. What are those things that you feel should be taken care of by trying to, if you're trying to keep people in country to be able to serve their country, either by legislation or by other means? But to you, as someone who is the head of the resident doctors, talk to me.
Last year, we did a study to try to find out the enormity of the problem we are talking about. That study also went ahead to assess the main reason why people are leaving. Let's call a spade a spade. The main reason people are leaving, doctors, nurses, pharmacists, is because of poor remuneration. The truth is that the salary structure we are using now, called Commerce 2009, it came into effect 14 years ago. And that's what we are still using up till now. Since then, you have inflation. You've had the dollar exchange rate sky rocketing. If I tell you that what I was paid as a house officer, that is fresh graduates who are doing house job, what I was paid about several years ago. If you compare with the dollar exchange rate with what I'm being paid now, you realize that I was even getting more then. See, nobody will see this level of underpayment and continue to stay. Secondly, the issue of a poor infrastructure, poor working environment, insecurity, and all that. See, we are not asking for too much, and see, there is no shortcut to this thing. If you do not fund the health sector aright, you are going to continue to have this problem. No doctor wants to stay in an environment where you know what to do to help your patients, but you don't have the facilities to do that. You are not encouraged. You don't have incentives. Why not bring up, welfare plans, welfare packages that will keep us here? If for instance, you give doctors houses in form of mortgage that they are supposed to pay over 5 years and all that, are they going to leave? They will not leave, because they have this mortgage to offset over a period of time. If you give them car loans and all that, but they are not thinking about that. They are thinking about forcefully keeping us here without throwing in the needed funds to resuscitate the system. We have been talking about this poor funding for a long time. I think the last time I was on this program, I talked about Abuja Declaration of 2001, where heads of states of African continent came up with this policy that for any nation to make any visible improvement in their health sector, that they have to budget minimum of 15% annually to health. That was signed in 2001 in our federal capital territory, Abuja. Nigeria was a signatory to it. But since then till now, this country has never passed, from the records available to us, we have budgeted more than 6% to health. In fact, the 2023 budget, that's this year's budget, the figures we are seeing is around 5 point something percent. So if you don't have this adequate funding, right, how are you going to have enough resources to take care of the remuneration challenges we talked about, the infrastructure and all that? The other issue is that, again, proper research should have meant that this honorable member should have told us, if you are talking about medical education being heavily subsidized to what extent, okay? Because it is too simplistic to say they pay this amount in US, they pay this in Nigeria. What is that payment meant for? Or maybe you try to compare with what they are paid in private institutions. You cannot do that. What the payment is meant for what? Because by the time you put all these things into consideration, you will see that the subsidy they are talking about is not even much. And again, is there any special subsidy they are giving medical doctors in school or medical students that they are not giving others? Is there any special? So why are they singling out doctors? These are the questions that they should answer. You cannot enslave doctors. And you want to say that, okay, this doctor is fully qualified to practice, but you are not going to give him his license. What is he going to be doing for 5 years? You want to create a pool of unlicensed doctors to be practicing for 5 years. Who does that? And again, this will not even stop people from leaving. If they have done that, they will know that even as a doctor without license, you can live. Okay, and by the time you start bringing in these draconian laws, you are going to drive people away from even coming into the practice, because they will just look at it and say, why am I coming to enslave myself? They will simply go to other
countries, yeah.
And we no, it's not even country. They will go to other courses. You know, and with time, you start reducing the number of medical students and ultimately the number of medical graduates, and you end up worsening the shortfall we are talking about.